DTHF Dialogues, Voices for Health, Equity and Innovation.
I'm Nomathemba Chandiwana, Chief Scientific Officer here at DTHF, and today I'm joined by Jen Manne from Harvard University. Jen, tell us a bit more about yourself.
Thanks so much for having me. I'm excited to be here at DTHF, and my name is Jen Manne, and I'm an HIV physician scientist and researcher at Harvard Medical School and the Brigham and Women's Hospital. My main focus is on obesity and diabetes as complications of HIV, in particular clinical trials and health systems research in this area.
Sounds really interesting. So tell us more about your work and what you're working on currently.
So currently we're focused on how to manage obesity in people with HIV. Specifically, obesity is a more recent complication of HIV and one that has evolved, especially here in South Africa and especially for women in South Africa, from new and excellent treatment regimens for HIV, which unfortunately as a side effect or complication can often permit people to gain excess weight. Our work is focused, as you partly know, on clinical trials to look at ways to reduce the risk of both weight gain and other complications that stem from it, including diabetes and cardiovascular disease in these women, as well as how to influence guidelines about the use of new treatments and other forms of lifestyle support for patients with HIV who experience weight gain.
Jen, what you're saying is really important, particularly for South Africa, where even outside of people living with HIV, we've got an obesity epidemic. What kind of questions do you think as researchers in this part of the world we should be looking at that intersection between HIV and obesity? What are the gaps?
I think the most important gaps are for there to be locally derived evidence about the best treatments. Those may differ partly in women and men with HIV. They may also differ for adolescents and children with HIV who experience weight gain on modern antiretrovirals. And so we should be thinking about what are the best treatments for this population, and then how do we translate that into a health systems approach that cares for patients who have HIV and then experience weight gain. So for instance, how do we integrate preventive activities like physical activity and diet modification where we can? And then what kinds of treatments, medical therapies can people potentially have? And how do we actually bring those to South Africa and scale them up?
So HIV, in South Africa has been a way of us learning the healthcare system. A lot of lessons have been learned that we can use for this new issue that we have in this part of the world. From your work and the other work that you're doing, what kind of lessons do you think we can learn from HIV for us to look at obesity and its complications?
So actually, one of the most exciting things about getting to collaborate with you and DTHF on this work is in fact the cross-learning that we have and the amazing opportunity to think about how the ways that you all approach HIV care in South Africa and that sort of stunning success can help us to do better for people who have also obesity and diabetes. In particular, I think that what's most needed is to think about all of the ways in which HIV care came to be something that was a quote-unquote non-existent system to one that now serves over 6 million people and has many millions of people well suppressed and living healthy lives. So how do we do the same for people with obesity? We think about a multi-pronged approach: research, implementation, guideline generation, and policy translation. And then how do you make that affordable and sustainable? And then finally, how do you scale that up? And all of those lessons are things that we can take from all of DTHF's experiences and your experiences and try to use those